The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos.
Thank you. Thank you for letting me share this 10th ADAO conference. It's my 8th time I'm here, and it's a great honor for me to talk about the actual situation of asbestos-related diseases in Germany. Asbestos products were very widely produced and used in Germany for many applications: construction, textile industry, and brakes, insulation, and so on. I will give you an overview about the consequences of the asbestos use in Germany, and which is very long-lasting. For myself, I'd like to introduce, I'm an occupational physician at the University Hospital of Cologne. I'm in charge for the health of the people who are working today there with different other exposures, but I'm also see patients every week for evaluation of asbestos-related diseases. This is a figure about the asbestos consumption in Germany, which mainly occurs between 1960 to 1980. All in all, there were approximately 3 million tons of asbestos used in Germany. And we have a ban of asbestos in 1992. But this doesn't mean that there's no more exposure, even after there is a ban of asbestos. And I will show you there's still exposure and there's still risk of asbestos-induced diseases, even for people who are exposed today. You see here, there was no asbestos use and consumption because in World War II, we did not receive asbestos from other countries. And the first factory in Germany was founded in 1870, which were the Frankfurt Asbestos Works, and they produce asbestos textiles. And from this experience, it was already known in 1938 that lung cancer in combination with asbestosis was officially, legally recognized as an occupational disease in Germany in 1938. This was long before this happens. And you see here, these are the lines of the diseases: lung cancer and mesothelioma, which start with average latency periods 20 to 40 years. Today, the average latency period is already 40 years for mesothelioma at the moment. And you see the increase of the diseases with a latency period. And we have currently 1,000 cases every year, occupational mesothelioma, and 800 cases lung cancer every year, which are compensated, which are accepted as occupational disease in Germany. Mesothelioma was an officially occupational disease in 1970 only, and later, 1979, we had additional occupational cancer from the larynx, which was also considered cancer from occupation in Germany. These are the 3 types of cancers which are organized in Germany. But these are all admitted cases, what you see here, 1,000 mesothelioma a year. These are the figure of the federal statistics, and we have every year now almost 1,400 cases, people who die from mesothelioma every year in Germany. And those are the cases, 1,000 every year, who die from occupational mesothelioma. So there is a gap of 30%, which are non-occupational, which are household contacts, which are children who are growing up in the households where mostly the fathers work in asbestos companies, or they are environmental or by other products which are sold somewhere. So almost in Germany, 30% are non-occupational from the statistics. And the incidence per year approximately is 15 to 70 cases per million. And the baseline incidence before the asbestos was used was 1 per million cases per year. So, even after ban of exposure, there are still problems. We have the asbestos is still there. We have them in the houses, in the buildings, in schools, in kindergarten, and this is still an almost weekly problem. We read in the newspaper it has to be removed. There's exposure of children, of school children, or of people, of residents who work there. So it does not change the exposure because there are technical guidelines for removal, but removal of asbestos from houses, from schools, is very, very expensive in Germany if you do it by technical state of the art. That leads to the consequence that it's not always done like this. It's mostly, or not mostly, but a certain part is illegal. So even the workers don't know what they are doing. They are not informed, and also the people who live there or who use attend the kindergarten, excuse me, also don't know it. So they're also not informed still even today. So, and if they know that there's asbestos in place, of course they have much fear. We have to deal with the fear of the people. They don't know what happened in 30 or 40 years. Will they develop mesothelioma or not? So this is still an almost daily problem what we have to explain, and the health risks due to asbestos in place, which has to be maintained, repaired, or removed, are still existing. No need to say that from the occupational admitted cases, which are compensated today or in the last 30 years, 75% were asbestos related. This is changing a little bit now in the last years. Benzene is very dominant, leukemia due to benzene, but still asbestos is the main cause of occupational cancer in Germany. In 1972 and 1973, the insurance companies, they have programs, so they were thinking what can we do with the workers that were exposed. They have the asbestos inhaled, and they established a central register where all workers who were occupationally exposed before are included in the register, and the goal was that they are registered first and also examined regularly for asbestos-related diseases. So all occupational exposed workers should be in the register, which is not totally the case, but every employer should register his employees for the central register. And this is the one you see here, the amount of people. In 2010, there were more than 550,000 people in the register who were formerly asbestos exposed. So a large amount, and they are yearly, until 3 yearly, offered regular screening for asbestos-related diseases. And this almost 330,000 people, they are offered regular examinations. And you see there are still almost 80,000 who are still exposed today because of asbestos removal, asbestos repair, and so on. So we have those who are formerly exposed and those who are still exposed. What is done during the regular examination is, of course, the detailed history of exposure, physical examination, pulmonary function testing, X-ray, and high-resolution CT for high-risk groups. If there are any changes in the CT, they will also do some special further examinations like spiroergometry to detect early changes. We don't really know, we do this since many years, since 1972, but we don't really know the benefit. Maybe that some cases can be found out early with a diagnosis, but it's not proven that screening really reduce the risk of dying from these asbestos-related diseases. The only thing what we can do with this, what is sure, that they can get compensated. But compensation doesn't mean anything to the health of these people. So it's not still until today, it's not really proven that even by high-resolution CT, you can have an early diagnosis and better treatment outcome. It's still a debate about this. There's not solved the problem of household contacts. They are considered non-occupational. That means nobody is in concern with these people who are exposed in the household. Women mostly who wash the clothes of their husbands coming from work. This was very normal during the 70s and 80s. And children who are in their home. The fibers are in the house and in the home. And also sometimes they go to the companies to visit their father and come back and were exposed to asbestos fibers. And this issue, it is also part of the Berlin Declaration, what you signed just a couple of weeks ago, and nobody cares about them. There's no compensation, there's nothing. It's like a disease like any other. And this is a big problem still. And there was a court rule already some years ago. The federal court is the highest court in Germany, and he ruled that household exposure is not an occupational exposure, and this is a duty of the housewife to wash the clothes of the man. That's really what they said in the statement, and they said it's not an occupational disease. This problem is not solved. Also, the Parliament is not solving this problem until now. It's a big problem for those who are suffering these diseases. But this is standing what it's today. About therapy, there's not much new. Of course, individual therapy is preferred, so it can be combined. We have the problem, those who are occupational exposed, they are today mostly older people already. They have other diseases, so therapy options are very limited. This is a problem with the older people we see, which are occupational exposed. But there's, of course, surgery, if appropriate, if possible, immunotherapy, chemotherapy, but the focus is on an individual therapy for those patients. In summary, even after banning of asbestos, that is my message here too, it doesn't solve the problem, but we are far from this in many countries. But even if you achieve that in every country asbestos is banned, the problem will continue decades. And this is a big thing, I think, and it costs a lot of money, but not for the companies. What you say, right, is it's a cost of the people who suffer. We have still exposure even after a ban of asbestos, because due to asbestos in place and removal of asbestos products, and mesothelioma mortality in the general population is still increasing, even after this long time. And we have more than 300,000 formerly asbestos-exposed workers who are offered occupational health screening exams. And mesothelioma is still the most common occupational malignancy in Germany, still increasing, and approximately 1/4 is not occupational, environmental, or by other caused by other products. And curative therapy has a limited outcome. I like to finish with a quote, which was already also mentioned, from the 30s. Looking back in the light of present knowledge, it is impossible not to feel that opportunities for discovery and prevention of asbestos disease were badly missed. All workmen should be told something to the danger of the material which they come into contact, and not left to find it out for themselves. They have to be informed. In Germany, they were not informed between 1960 and 1980. Nobody knows what he's dealing with when he used asbestos, sometimes at the cost of their lives. And this was not Today, this was already 1934. There was an occupational principle written in a book, and but still not observed. Together, let us do all what we can, following Dr. Selikov's words that the future not be a mirror of the past. Thank you.